You can't stop acne breakouts without taking hormone therapy, but you are, in a way, affecting the hormones. A lot of women get prescribed birth control for prevention of acne, but it's actually not that effective. I think the most effective, and personally my favorite treatment for my patients for acne breakouts is actually using a medicine called spironolactone. So spironolactone is a medicine that has to be prescribed by a doctor. It is interestingly a antihypertensive medicine. So it's for lowering your blood pressure. But it does have an impact on hormones. So what spironolactone does is it reduces the testosterone level in women just to a small extent so that they stop breaking out. It's very effective. You don't have to be on it for the rest of your life. Most people with hormonal acne grow out of it. So taking spironolactone for a few years is a great way to control your acne, and then you can stop when you've grown out of it. There is a deep connection between hormones and acne in both men and women. Most people start experiencing breakouts when they're in their teen years, and that's largely because they're having huge hormonal changes. So it's not really the level of the hormones that's the problem, it's the rapid changes. The best way to support that period is not to worry about being on any kind of hormone treatments. If you have very moderate to severe acne, consider things like spironolactone in young women or even Accutane if the acne is more severe, which can be used in both young men and women. When it comes to acne prevention, I would say procedures are not the number one thing to go to. Acne is very complex, and a lot of the complexity with acne has to do with your daily routine and your skincare. Once you have overcome and maximized your improvement in those parts of your lifestyle, then treatments can be an option. But when it comes back to skincare, using some sort of exfoliant that doesn't strip your skin of oil but just balances oil production is the number one way to incorporate a skincare product that will help with acne. If your acne is more on the moderate to severe side, you're likely going to be put on some sort of medicine, which is an oral medicine. And then finally, when all of those things are in place and you continue to have breakouts, simple microneedling that can help restructure your skin and reduce the amount of pimples and also scarring early on so that when you do grow out of that hormonal acne period, you have less scarring. We could make the argument that stem cells and exosomes can prevent acne because acne is an inflammatory condition. Stem cells and exosomes are excellent at reducing inflammation. However, most people with acne are younger, and their body, interestingly, does have a lot of ways to fight inflammation. So I would say, in my practice, I don't jump to stem cells and exosomes when people have acne. I first optimize their skincare routine and then go to simple microneedling, and usually that does the trick. Acne prevention can be very different depending on skin tone. If you have a lighter skin tone, you are likely not going to have as much scarring or dark spots after you've grown out of that acne period. However, with people who have darker skin tones, I think the key to prevention is started early. If someone has acne in their teenage years and it's moderate to severe, it is likely going to cause a lot of scarring that is very stubborn and difficult to treat. Considering treatments like oral spironolactone in young women, or even Accutane in both men and women if the acne is severe early on is an excellent way to prevent future scarring that can be really deep and dark spots. But if you're looking at just skincare, and that would be in the case of someone with mild to moderate acne and you have a darker skin tone, make sure you're not overstripping your skin of oils. So using facial brushes all the time to wash your face, or scrubs that have really coarse materials, or something with a really high concentration of things like salicylic acid or benzoyl peroxide without moisturizing your skin is definitely going to not only make you produce more oil and worsen acne, but also cause more dark spots. Instead, using a cleanser that's balanced with an exfoliant like salicylic acid or benzoyl peroxide, but has a moisturizer within it, which there are many cleansers that do that. And then making sure you moisturize your skin instead of leaving it without a moisturizer, thinking that you have very oily skin, will definitely prevent you from having very severe scarring and dark spots after you don't have acne anymore.